Okay.
Clear?
Mm-hmm.
All right. Good afternoon, everyone. Here with Bob. Bob is the sixth stroke survivor I've worked with over the years. We started work together at Next Step Atlanta Paralysis Recovery. That work continued. Beyond that, beyond the exercise model, I should say. And so, within the exercise model, there are always restrictions that we see and people's gaits and movement, and that may be a fascial restriction, that may be muscles not firing from the nerves not functioning properly, a variety of things. But one of those approaches to answer some of the fascial restrictions and mobilizing musculature has been the use of electrical stimulation in areas where necessary, the use of medical massage and orthopedic manual therapy where necessary, and I introduced to Bob pulse electromagnetic field therapy. Through the research, I read enough of it that it built a strong confidence in me, and convincingly, I shared that research with Bob, and we both partook on a journey with its use, and it improved his gait, it improved his motor functioning, it improved a variety of things, along with while doing massage therapy twice a week for 30-minute intervals. Um, that work has gotten him approved for multiple additional therapies, occupational therapy and additional physical therapy and aquatic therapy that would have otherwise been denied for his lack of ability, as a matter of putting it. And a lot of folks around the nation are dealing with that. If they can't do it, the traditional therapists cannot perform their therapies that they offer if the person can't pass their specific test. So in this case, we had another good news today. He's went to see a specialist, a neurologist,
He's a
Podiatrist.
podiatrist
Yes.
specializing
And
in
specializes in it. And something unique, we've always said with the paralysis world, with getting tibialis anterior to fire, to lift the toes, to dorsiflex the toes while walking, has always been one of the hardest things people have had to deal with, i.e. they end up with drop foot, and you either need a stimulator or some type of special brace to keep your foot flexed upward so that you're not dragging your toe on the ground. And we've been working without the bracing and working more with manual therapy methods and shockwave therapy recently to mobilize his ankle and to get tibialis anterior to fire better while he's walking and gait training. So I come today and Bob gave me some great news.
So the great news is I am, as I said, Tony said, I'm seeing a podiatrist principally for foot pain and principally to address a condition known as equinus or horse foot. So quickly said, what the doctor will do is to make an incision in my gastrocnemius, which will hopefully loosen my Achilles tendon, thereby allowing me to plant my left foot flat on the ground. However, before he was able to do that, he had to test to make sure that the muscle to which the tibialis anterior is attached still had electrical neurological tone and sufficient to respond positively to the surgery. So the good news, Tony, is that after the test, the doctor said, Bob, the muscle's alive, so it's definitely worthwhile going ahead with the test. And I credit that muscle remaining alive despite 2 years and a little bit of being inactive following the hemorrhagic stroke to just constant trying to exercise, as Tony said, massage therapy, electrical stimulation, all sorts of other stuff, and being persistent and keep going. So thanks, Coach, and we'll move on to the next stage.
Yes, sir.
All right.
All right.